I'm worried that Mrs. Randall is having problems with constipation. She hasn't had a bowel movement for several days. Her care plan says that digital stimulation can be used in this situation. I'm not sure what that is. Can you help me?
Of course. I'll come by in about an hour and we'll show you how it's done. People with spinal cord injuries sometimes have difficulty with bowel movements. Digital stimulation offers a way to help the client empty their bowels without the use of medications like laxatives, enemas, or rectal suppositories.
Oh, that makes sense.
In fact, use of digital stimulation at the same time every day can help train the bowel to go at a specific time.
So, what is it exactly?
The name pretty much says it. It's the use of a digit, meaning a finger, to stimulate the walls of the rectum. It's sometimes called sphincter stimulation. The sphincter is the group of muscles surrounding the anus. It may also be called dig-stim or rectal touches.
A finger?
Yes, usually a finger, gloved and lubricated, of course. There's also something called a dill stick, which is a device that can be used in place of a finger. They're designed for the individual to use on themselves if they don't need assistance.
I think it will help for me to see you do it.
Here's what you'll need: gloves, lubricant, a bed protector pad, toilet paper, soap and water, washcloth and towel, a bedpan, and a plastic bag for waste. We need to wash our hands and put on gloves. Okay, now let's talk to Mrs. Randall and explain what we are going to do and why. Good morning, Mrs. Randall. Jenny tells me that you've been having some trouble with constipation. I'm here to show her a procedure that I think will help you.
Thank you. I appreciate that.
It's called digital stimulation. I'm going to gently touch the muscles in the rectum to help them to contract and release stool. You shouldn't feel any discomfort.
Well, if you say so, dear.
We're going to help you remove your clothes and undergarments. Then we'll help you lie down on the bed. It's important that the client lie on their left side for this procedure. Can you make sure that the bed protector is underneath her? Make sure she's covered and comfortable. Are you okay, Mrs. Randall?
Yes, dear. Thank you.
Okay, I'm going to start now. I'll be describing the steps for Jenny as I do them. First, I apply lubricant to my index finger. Use plenty of lubricant. Next, you'll want to observe the perineal and perianal areas and note any abnormalities. Then place the hand that is not lubricated gently on the client's hip. Now, gently and slowly insert your lubricated finger into the rectum, approximately 1/2 to 1 inch, or about to the first knuckle. Move your finger in a clockwise circular motion against the wall of the rectum for about 20 seconds. Remove your finger slowly and wait for the stool to come out. Now, on rare occasions when you're doing this, the client can experience a sudden increase in blood pressure known as autonomic dysreflexia. Symptoms include sweating, headache, and chills. If this happens, stop what you're doing and call me, okay?
Oh gosh, of course.
How are you doing, Mrs. Randall?
I'm fine. No discomfort.
When the stool passes, you should put it into the bedpan. You need to repeat the digital stimulation every 5 to 10 minutes until the bowel is empty. If no stool passes after 3 tries, you need to stop. We may need to contact our healthcare provider for alternative options.
I'm sorry, this may take a while.
That's all right. You do what you need to do.
Okay, let me see you do it this time. Slowly. Good. Feel the wall of the rectum? Now gently rotate. That's right. And stop. When you're finished, wipe the client's anal area with toilet paper, then clean the area with soap and water and dry with a towel. When that's done, remove your soiled gloves, wash your hands, then put on a clean pair. Assist the client to a comfortable position and help her get dressed. Ready to get dressed, Mrs. Randall? Is this outfit okay?
Yes, that'll be nice. Thank you.
It's a good idea to use clothing that is easy to adjust in case she feels the need to use the bathroom. Observe the condition of the stool, then empty the bedpan into the toilet and clean the bedpan. Remove your gloves and wash your hands. Be sure to document the procedure and note the condition of the stool. Do you think you'll be able to do this yourself next time?
I think so. Thanks for showing me.
Not a problem. That's what I'm here for. How are you doing, Mrs. Randall?
I'm just fine. Thank you, dear. I appreciate the two of you taking care of me.
Not a problem. That's what we're here for.